apologize for the craziness here. My computer audio isn't working, so I had to come over into Pam Smith's office, that's my assistant, and use her computer. And Scott Erdley is still trying to fix my audio on my computer. So here I am. So I'm not Pam Smith, I'm actually Dean Thomas. It's nice to see you all bright and early this morning. I know I've seen you both groups in the last 2 days. It's been fun, and we're here today to take the pledge, an honor pledge, and you've all had an opportunity probably to read that honor pledge. Nursing is a serious commitment, as we talked about in class, that you need a commitment to your patients, a commitment to nursing, a commitment to do the best you can and to do the right thing. And this honor pledge really recognizes that you take a solemn oath as a nurse, as a nursing student, to uphold all the values of nursing. And that's what this event is all about. I wish we could do it in person because it's wonderful activity when we've been able to do it live and in person. But barring that, here we are. And so I'd like to pass the microphone to Dr. Kim Baxter, who's the Associate Dean for the undergraduate programs, and she's going to continue with the program. Kim?
I apologize, my mouse didn't want to work. Can you guys hear me okay? There we go. Thank you, Dean Thomas, and Dean Thomas, faculty, and of course, our wonderful class of December 2021. We are so excited to be here with you this morning as you celebrate and dedicate walking through this door into your nursing program. For a long, long time, faculty, we've always had one of our favorite things is convocation. So the end of the program where we get to celebrate all your hard work and you're pinned on stage by your family. But also there was, especially for the faculty that taught in those early levels, it was a little bittersweet because heck, you worked so hard to get here. Couldn't we do something to celebrate and dedicate your moving into school, which in essence are the first step in the profession? So we had this very innovative committee that got together and developed the Honor Pledge. So the Honor Pledge was born. And in this Honor Pledge, hours were spent really trying to articulate themes that will infuse your nursing education, but also infuse your role as nurses. So while this pledge is very important to look at and take seriously today, this is not something that we want you to pack away and put in a closet or the attic. We want you to be able to pull this out, especially on those hard days, especially on the days as a student or as a professional nurse where you ask yourself, what in the heck have I signed up for? And do I still want to be here? Because like a marriage, we need to recommit all the time. We need to make sure we are there because we want to and get in touch with the values that brought us to the program there. So in just a few minutes, Professor Schwade is going to pull up the Honor Pledge and we're all going to read that together. I would also ask that any nurses, faculty that want to read this with us to reconfirm these really important values will go there. Also, I am so excited that later today, Professor Schwade is going to send you the link to your Honor Pledge website. And remember your selfie, your Nursing Is selfie that you did and your statement that you made. I cannot wait for you to see this released, because to see your wonderful faces and to see what brought you to nursing and the descriptors that you use to describe what nursing is, I'm going to read just a few of them that are there, but it's, and I've looked through it about 3 times, and every time it just makes me smile and almost brings tears to my eyes. So things like, of course, compassion, kindness and dignity, morality, being reliable, a rewarding challenge. These are some of the words that you all use to describe what nursing means, what nursing is to you. It's a privilege, dedication, what heroes do, caring, invaluable, a rewarding career, perseverance. There's all kinds of wonderful things that you talked about, and every single one of those is important in who we are as nurses and surrounds us and weaves its way through our daily life and our years in the career. And we want you guys in the career for years. We want you taking care of us, and as we move to that other side there. One of the things that I'll bet you Dean Thomas talked about in Fundamentals this week is that the Gallup poll has elected nursing the most trusted profession for, I'm thinking it's up to 18 years right now. And this is a huge honor, but it's also a huge, heavy responsibility. When I look at all of you, I look at how you talk about what brought you to Orvis, what brought you to want to move into the nursing profession. I see these kind, compassionate, exciting faces that are anticipating moving forward. But also there are things, even though if we don't think they're there, that could be under the surface that can block us from truly connecting with patients or giving the best care. I look at those as some of my lightning bolt moments that I've had, certainly personally and professionally as I move through my career that has changed and informed the nurse that I am today. I want to share one of those with you this morning. And this was a fall day and I'd been a nurse for quite a few years. I was working in an emergency department in Southern California, a very busy emergency department. I considered myself an expert nurse, and I also considered myself to be a kind, compassionate person. But what happened that day shook me and gave me a lot to reflect on. So we got a call that there was a near drowning coming in 9 months, who had a near drowning episode from a freshwater swimming pool. So when I hear near drowning, the first thing that came to mind is, we've got some sort of vital signs that are back. And in this case, this little guy had a pulse, and they were able to get a blood pressure in the ambulance coming in. And as we were preparing the room, the first place I went, I have 3 sons, and my middle son was about 18 months old at the time, and thinking, how in the heck does a 9-month-old get within proximity where they're not being supervised to a swimming pool? Because that can lead to horrific things like this. So I'd started making judgments from the get-go on this mom. And I also went to the place of, I will never let that happen myself. I would never let my children get in danger of drowning. And so they came in. By the time the medics got in, this little guy was intubated. He had been pulseless and apneic initially, but with BLS, and they gave some epinephrine. He got a heart rate back. And since he wasn't breathing on his own, they put the breathing tube in. But by the time he got in our code room, you could see him doing some external indrawing, and he was trying to breathe on his own, which is really hopeful too, because we've got more brain stem function this is showing. Also, he was flaccid, so he wasn't starting to move his extremities, but he was pretty stable. His vitals were good. We were really lucky in the county where I worked is that we had a great children's hospital. So their critical care transport team had been mobilized from the minute we knew that this little guy was being transported into the hospital. So they weren't that far out coming in. So we were keeping him stabilized, certainly monitoring. And Dr. Mannix, our ER doc, went out to go and talk to the mom. And just a few minutes later, I was running out to go get some meds out of our med cart. And I see Dr. Mannix, and he's walking in with who I assumed was the mom. And she was kind of a big lady in her, I would guess, early 30s, and disheveled. Her clothes were wet. And so I went to, she probably jumped in the pool to get the baby out, which she had. And she had that look of anxiety and panic where you see everything is pulled in. So the only thing they're focusing on is what's directly in front of them. And this little one was continuing to do well. He was starting to move all of his extremities in the room, wasn't responding to commands, but mom was at the bedside. Critical care transport arrived really quickly. We packaged this little guy up. The social worker called the mom's sister, who came in and was going to be driving the mom down to Children's Hospital. And Dr. Mannix and I were standing there watching as they roll out and load up this little fella into the critical care transport ambulance and took off. And Dr. Mannix said, no family should have to experience what she has gone through in this week. And I remember going to, of course, nobody, how awful to almost lose a child. And I looked at him and he was crying, which was not something I often saw our ER docs do. And he said, this morning, this mother buried her 33-year-old husband from testicular cancer that he was diagnosed with 3 months ago. They came home from the funeral, and she has 2 older children that are 9 and 5. And she said all she can figure, she fell asleep on the couch. And the 9-year-old, trying to be helpful, wanted to take the baby outside so the baby didn't wake the mom. So they opened the slider, and of course that little guy made a beeline straight for the swimming pool. In he went. They both, that 5-year-old and 9-year-old, tried, and thank God they did not go under, tried to get him out, but couldn't. They woke up the mom, and she woke up to see her infant floating face down in the swimming pool, pulled him out, and then started CPR right away. And then he arrived in our care. Thank goodness he did really well. He was only on the ventilator the rest of that day. He was extubated. From what they could tell, he had full brain function back. But I tell you, I was horrified and embarrassed that this kind person I thought I was would have judgments about things that I really did not know about. And it gave me an opportunity, their story gave me an opportunity to spread my wings and really reflect on this and make a commitment to myself and to my future patients that I would key in, if I was getting into that judgment realm, that I would step back and I would not have expectations as far as what I think people should do. And even if people were making choices that led to some bad outcomes, I would still refrain from that shoulda, coulda, woulda mentality. And I feel as strongly today the lessons that I've learned from both the mom and the baby that day, and how thankful I am for that. I would ask that you think about that with your patients, because we're going to be meeting patients that have different values or have made choices that we would not necessarily have wanted to make for ourselves. I also ask that you offer that same unconditional openness to your faculty, to your student colleagues, to the nurses that you're going to be working with as students, and the nurses that you work with in the future, so that you truly can approach and partner with patients wherever they are. That doesn't mean we don't have boundaries with patients. It doesn't mean that for that patient that's smoking that we're not telling them they need to stop smoking or we shouldn't be drinking and driving. But being able to do that from a place of acceptance of where they are and realizing they have to be the ones that deal with the consequences, and certainly accept whatever plan we put forward. So with this in mind, let's jump into this nursing pledge. We're all going to be reading this together, so I'd ask that you unmute your cameras. Okay, so please read along with me. Before family, friends, alumni, guests, I
solemnly
solemnly
pledge
pledge
to provide
individualized
patient
care,
compassion,
respect
respect,
to
to ensure implementation of the best practices.
I will embrace the diversity
of
of my patients' life experiences,
culture,
spiritual,
and healthcare
beliefs,
will
will individualize my care,
support their needs,
prioritize
patient act as a patient advocate.
grow not only
Grow not only from my triumphs,
my mistakes,
commit
commit to becoming a lifelong
learner, and
humble in my pursuit,
will use my
knowledge to improve the health and well-being of my community.
pledge to collaborate and communicate in a professional, compassionate manner with the help of
my
the academics
in my academic attainment.
will not disclose confidential information, and I will be cognizant of my words and actions. Pledge to engage in my own self-care
In integrity and strive
for integrity,
personal
and professional growth.
pledge to maintain and improve
An
the
ethical
ethical
learning
environment and
academic and to provide an environment of patient innovation in the field of nursing. And recognize
to me as a nurse,
supported to me as a nurse,
promise to afforded to me as a
promise to
nurse,
uphold the reputation of
hold the reputation of honor and privilege afforded to me as a nurse and nursing student. I promise to uphold the reputation of this dignified profession. I love it. See, you guys were ready to move on through that. Well, thank you all. Thank you all for being here and your dedication to the profession moving in. And Dean Thomas was going to close with a few words.
Yes, I'm actually back on my own computer. Scott got it fixed. Can you hear me?
Yes.
Okay, it is fixed. It's just so wonderful to see you all. And I am so honored to be able to teach one of your first classes. I look forward to having discussions about what the values in nursing are and how we can uphold them. We talked some on Monday and Tuesday night about that. And I think this is a fun time, a solemn time, and a great beginning to your nursing career. It is the best career I could have ever hoped for. Even though it wasn't something I particularly wanted to do in the beginning, it has turned out to be the best thing I've done in my life. And I hope that you all find that that is the same for you all as well, because it's the greatest. Once you find your space in nursing, what it is, your little niche, and sometimes it takes some of us longer than others to find that place. Dr. Baxter found it early on. It took me quite a number of years to find my place, but it's just the best. And I really look forward to teaching you the rest of the semester and being at your graduation, because believe me, it will be here sooner than later. It will go by in the blink of an eye. I know you find that hard to believe right now, but truly, it'll be over before you know it. So I thank you. It's an honor for me to be able to be the Dean of the Orvis School of Nursing and to have all you bright people entering into the profession of nursing. So thank you. Are we done?
Thank you, Dean Thomas. Thank you, Dr. Baxter. And thank you, students and family and faculty who joined us today. So we will have our book signing and get your pledge certificate in our front loading at Station 4. So that will be this week, later on Thursday and Friday. Okay, so we're moving on to the students. We're moving on to the next section with another Zoom link for the immersion, and I will see you guys there. Thank you, everyone, for coming. Take
Bye-bye.
care. Bye-bye.
Bye.
Congratulations and welcome.